After a sweltering summer, sweater weather has arrived, and while you may want to embrace the cooler temperatures, be cautious.
We know that with the colder weather, it's actually easier to spread the flu. So when you sneeze and you all these droplets come out in hot, humid weather, those droplets fall out quicker. In cold, dry weather, it's been shown that they actually go further.
Dr. Tanya Watts says this flu season could be a doozy.
We get some insights from looking at what happened in the southern hemisphere, where their seasons are opposite to ours, and they had a pretty significant flu season, for example, in Australia this year. So I think we can expect some severe flu.
Unpredictable because the influenza virus is always changing. Strains can differ even within one season. That's why it's hard to nail down an exact vaccine. Watts says a recent report on the vaccines deployed this season show them to be about 50% effective in preventing doctors' visits and hospitalization.
So with all you hear about how overwhelmed our hospitals are, if you can imagine that we can cut the number of people going to the hospital with flu by twofold, that's going to be a really big impact on the healthcare system, as well as people getting less sick.
Aside from getting the flu shot, there are other ways to protect yourself and others. Watts walked us through the data, which clearly shows that those habits we learned during the pandemic were effective.
You can see different years, it comes up at different times, but usually starting November and ending in the spring. But this purple line, flat at the bottom, was the 2020-2021 season, and we had no flu. Remarkable. And it really shows that people wearing masks, staying home when sick, washing their hands is sufficient to actually stop the spread of flu.
Flu vaccines are currently available for high risk and priority groups. They will be available to the general public starting next week on October 27th. At the University of Toronto, Natividad, City News.